Imagine what it feels like for people in quarantine or for COVID-19 patients. It's a harsh new reality. Weeks apart from friends and family, you're cut off from work and your daily activities, and you are confined. Your only visitors are healthcare workers wearing head-to-toe protective gear. Now, in some facilities, daily guidance and support for dealing with those stressors is coming in from psychologists. But given that the coronavirus crisis is likely to be with us for some time, the mental health implications cannot be dismissed. Tonight, we speak to Kirindi Odindo. She's a clinical psychologist and psychotherapist, and she's speaking to us live from Mombasa County. Kirindi, good evening.
Good evening, Lillian. How are you?
I'm very well. I trust you're keeping well. You're keeping safe.
Adapting.
Okay. Kirindi, let's get right into it and let's talk about some of the mental effects of isolation you may have observed in medical quarantine centers. What are these people going through mentally?
Well, for me, because I am away on satellite, most of the support we've all given, and we're a team of quite a number of psychologists and psychotherapists who are called on at different times to support, would be pretty much you don't get to see them because often enough the internet doesn't work very well. So you have to rely on phone, or you have to rely on just being able to get on a WhatsApp call or do some chats as you go along. But often it's the same stresses, the frustrations, the clear feeling of being trapped, being powerless because they don't have an option. They're not able to help themselves get the support they would normally have, and that support is removed. And I think it's a unique feeling because it's not what's shared with the rest of us, who of course have the very same symptoms, but they will be to varying degrees depending on what our circumstances are. And socially, we are coming from very many different dynamics. So when we're caught out, I'm happy to be caught out in my parents' home. That's where I got locked in. Some people are locked out in places that don't give them the support that they require. They don't give them the resource that they need. Their human security needs are low. So in the quarantine centers, you're also getting a really different group of people as well. They've come from different extractions. They have pre-existing conditions. They have pre-existing situations, concerns, issues, and all those stresses don't stop just because they're in quarantine. If anything, they actually get augmented.
Mm-hmm. And, you know, we're not seeing as many stories of recovery. If anything, the news can be depressing, new cases, new infections on the rise. So not as many stories of recovery as there are of the infection. And while we have to face the reality of the situation by painting the picture as it actually is, how can we shift the narrative towards giving a sense of hope?
I think that begins with media houses, Lillian, because we rely on you for accurate information. We rely on you, especially now in our confinements. Our only ability to actually get a link to the outside world or what's around there comes from the media, whether it be radio or whether it be our WhatsApp social media channels. And often enough, the misinformation can also heighten the anxieties that we have. So if media houses could also choose to concentrate, and I laud you, Lillian, because having been here, Citizen is my parents' TV channel of choice. So I've watched you in the last 2 Fridays, I think 3 Fridays, and you've always brought in mental health practitioners. And that's something that allows people to ground, to solidify some of their resource, and not always think of the gloom, but be aware, of course, of what's going on with them. Mm-hmm. And so I think it goes back to who has command on news. And that command remains with media, and it remains with the government so far. Mm-hmm. And so that story must be sold by the same people we look up to ensure that we can be where we need to be in mind and heart and spirit and physical space.
Right. And tied to this, Kirindi, is, people in isolation still have access to their phones. They have access to perhaps the news on digital platforms. So the effects of stigmatizing language, and this could be from, bloggers, it could be from some news organizations, it could even be from the government. Some of the words that are being used, such as perhaps, quote unquote, blaming people for transmission. How can we protect those in isolation from this? The Nakuru County governor pointed out that one of the issues that is standing in the way of, controlling, the coronavirus right within his county is the stigma. The people who have recovered, who have since recovered, the stigma, and how essentially we can protect those in isolation, number one, and those that are admitted in different COVID-19 facilities under treatment from potential stigma.
That's a really tough one. And I'll just take you back to one of the people I was working with in quarantine. And he was older and pretty much at a space where he would be a little more secure coming out of quarantine. His children are out, finished college. But one of the things he told me and said, if this is the only message you will ever give out to anybody who's listening, is the stigma. And I think this comes from, where have we put the COVID situation? Are we desensitizing people in a manner in which that they take ownership of it in an embodied manner? And is there a dignity we give to the space of what health and illness is? Because if we're always focusing on the illness, then we never see the wellness. Mm-hmm. And this is unfortunately what is sometimes fueled when we're constantly on the fear of what should be done, whether in confinement or not. And so people tend to not respond positively to fear. We run away. And stigma is a moving away. It is a way that we detach from something as opposed to come towards something. And this can only be done if the messaging around what it is and the normalization of the space, yes, it isn't normal, but it is our new normal. So how do we start bridging that and making that our reality whilst still keeping behavior change principles that will keep us safe? I think this is going to be our health educators and behavior change specialists' biggest battle, because otherwise people will be in rebellion mode, people will be in defiance mode, people will be in that discriminatory place.
Mm-hmm. And, the fact that most people, Kirindi, are unaccustomed to prolonged periods in such situations. You've spoken about this eliciting, negative feelings in most people. Some already have pre-existing conditions, and therefore this just flares up, whatever it is that they were dealing with. What are some of the steps that can mitigate the effects of being isolated?
I'll start with just the common things that we do when we've lost something. Because this is like a grief response space and a grief response system. And it's death, but death in a different way, because of course we want to really console and condole with those who've lost their loved ones and think about all those around the world. But we all have personal losses due to this condition. Can we name them? Do we know what they are? Can we accept that that's what it is for now? Can we come back to what it is we know to do when we've been in painful situations, when we've gone through difficulties or tragedies and survived? Because we've come this far. And for many of us, we have had traumatic experiences, even though they might not look like horror stories. And this does look like a horror story in many ways. But we all have gone through huge hurdles and obstacles that we can come back to and come back and do what we call in our field, what's the post-traumatic growth point? Because we're constantly looking at the disorder, but the disorder doesn't come to many of us. When we support a lot of people in quarantine, you will be shocked that actually the average person gets to a place of acceptance and they move on and they're trying to figure out strategies in there. I've helped some people just get onto online courses, for example, or I'll send self-care strategy manuals and say, okay, can you map this out for yourself? Because these are skills you're going to need for life. This is not just a now skill. These are just health skills, health and well-being and mental hygiene skills. So coming back to acceptance, naming your loss, validating your fears, but not staying in there, and reconstruct and reframe those soon enough. And if you can't, then source help, because there are some helplines like the Red Cross 1199, 1199. That's there, it's available, it's free. For those who do have healthcare professionals that they've worked with in the past, as you say, they are people at risk, then this is the time to actually reach out. I've tried to reach out to every single one of my clientele, new and old, just checking up on them, seeing how they're doing, sending information, making certain, and I would urge people in our field and anyone else who gets positive material on coping to send that around so that people do develop new skills from here that are the soft skills that will take us to the next stage in life.
Final question, Kirindi. We cannot overlook health workers. Everybody is concerned about the patients, but, you know, few take time to consider the mental effects that this might be having on these health workers. They are stretched by demand. They are on call. They're exposing themselves, taking the risk of possible exposure to infection, but still, you know, just keeping at it and helping fight to save these lives. So how can they deal with emotions and stress as we cope, as we finish the healthcare workers, Kirindi?
Yeah, that's definitely a very special needs group. That's definitely an at-risk group because the nature of their work puts them right in the line of fire. So when you're a first responder, then part of it is already going to mean that you have found coping ways, but not necessarily healthy coping ways. So do they have peer support teams? Who is checking in on them? Now, what I understand from the strategy from the Ministry of Health, that psychosocial support is a part of it, but do they have the time to even go in and check in with whoever they're supposed to be checking in? And remember that mental health within our world, within this space, is still stigmatized. So the whole aspect of mental health immediately signifies illness, and immediately for us means that we can't cope, we're weak. And so when you're in a position of authority, how vulnerable can you allow yourself to be to access the help? And this is where the healthcare managers need to make certain and mandate, if they can, some kind of peer review if they cannot get out and get the kind of expert review that they would need to have. But call-in lines, call-in centers, and we're still early in the game, but I think these are going to be priorities that are coming together. I know the Kenya Psychological Association has just put through a paper to Senate that's supposed to help respond to this COVID-19, and we're happy to volunteer. We've done all of this voluntarily. So there are a lot of equipped people at different levels of mental health provision that can be accessible at this time to help support and volunteer their time.
Many
but of
thanks.
course, the sleep, eat, rest, the usual things of nutrition, but you know, when salaries are cut and where money is running thin, and this is where countries that have added the resource from, you know, healthcare providers and have augmented their purse to make certain that they're able to sustain themselves and their families as they give back. That alone is a huge security for them, and it allows them to look at their other human security needs.
We thank you for your time, Kirindi Odindo. She's a clinical psychologist and a psychotherapist. She's been speaking to us as regards the mental health of persons in a quarantine situation, persons that are currently fighting COVID-19 in different COVID-19 facilities across the country. As you heard her put it, there is a hotline center, Red Cross hotline center. You can look up their numbers online. Call if you feel that you need to talk to somebody to offer you psychosocial support as we deal and as we grapple with this pandemic.